Grey County. This program is brought to you by Rogers Xfinity, connecting you to more of what you love. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I'm delighted to welcome two guests to the program. And I hope I get their titles right, but if not, I'm going to ask them to correct me after I've gone through them. So Jason Leffler is the Program Manager for Public Health, Grey Bruce, and Jill Umbach. Now, Jill, this is a long title. Coordinator, Grey Bruce, Children's Alliance, Bruce Grey, Poverty Task Force, United Way, Bruce Grey. Have I got that close, both of you? That's almost a full program.
Yeah, I think you have our respective organizations, and I think you should also mention another title in the sense that Jason is also chair of the Healthy Communities Partnership Table,
Yep.
and we are actually coming to you today on behalf of that committee.
Excellent. So the topic is going to be about an upcoming conference. And full disclosure, I'm part of the planning committee, so my heart is close to this topic for sure. But today we're going to be talking about the Healthy Communities Conference 2026 that's scheduled for April 27th, which is a Monday, and April 28th, which is a Tuesday. And the theme is building a culture of wellness. So both Jason and Jill are here with us today to talk about the conference, how you can register, how you can support this initiative for our community, and just basically how it's going to flow. So who'd like to go first?
Yeah, I don't mind starting, Carol. I'll give a bit more of a detailed overview of the sequence of events for the 2 days. So as you mentioned, we're kicking off things on the Monday evening, April 27th at Sydenham campus. We have a scheduled agenda to run from about 6 p.m. to 8:30 p.m. We do have a panel presentation that'll be speaking to different aspects of health and wellness in our local communities. And then we have a great opportunity to do some tours of the site. So we'll be looking at the Changemaker Lab, the Community Impact Lab that's being hosted and held at Sydenham campus, as well as the opportunity to go next door and tour some of the facilities at Georgian College, as well as they're one of the main partners in this conference as well. So that's kind of a recap of the Monday evening. I can run quickly through Tuesday while I've got the mic. So the next day we move down the hill to the Bayshore Community Center. This will be kind of our larger day of the two-day event. We kick off around 8:15. People who have registered in advance will come check in, have some light refreshments for breakfast, and then we kick off the full proceedings at 9 a.m. We'll run until about 4, and we have a full array of sessions offered. We have a keynote speaker. We have a housing plenary session. We know housing continues to be a challenge across our Grey Bruce region. And then we have 6 different breakout sessions covering a variety of topics. So I think there will be a little bit for everyone who may be interested in attending.
Excellent. How did you come across the theme? Like when people attend, what are you hoping they will get out of this conference? What are the kind of the objectives?
I think for me, we all the members of the planning committee represent a number of health and social service organizations, and we continue to see, in some ways, our communities and clients still struggling with certain aspects of health and well-being. So I think this is an opportunity for organizations, individuals to hear and profile some innovative strategies that are happening across Grey and Bruce counties. We really try and be the rural leaders in many ways. There's always more we can do, but I think it's a great opportunity to come together, network, and profile some of the great work that's happening across the 2 counties.
Excellent.
Carol, I would just jump in and support Jason that it's not just one subject, it's not just one solution. So, the complexity of addressing health and wellness in our community at all ages and all stages is not just one simple solution. So, I think what the day and the evening to start offers you is a variety of what's happening in the community, what are some really progressive models. I'm thinking of some of the Indigenous led models that are really interesting and may not be something that's on people's radar. These are things that are moving ahead in communities that we may not interact with every day, or they may be part of what an individual sees, which we haven't promoted and which we can possibly look at replicating in other smaller communities across Grey Bruce.
Excellent. So before we get too far into the details, because I really want to entice our viewing and listening audience to register and sign up. So we're going to give them a more detail about the menus that they can choose from. But obviously, conferences cost money. And there's not always a lot of money through grants. Jason or Jill, are there sponsorships? How can people support this initiative? And I'm assuming you're looking for sponsors.
Yeah, absolutely. We always endeavor, Carol. We've held these events for several years now. We always endeavor to make this a kind of a cost break-even event, I should say. So we're not looking to make money on the event, but we recognize there are some expenses in terms of facility rentals and supplying food and securing keynote speakers and those types of things. So yeah, we certainly try and keep our registration costs as low as possible. And to do that, we do try and elicit support from sponsors who may be out there in the community, someone whose business may be aligned with the theme of health, wellness, and well-being, who might like to profile some of their programs, services, equipment, those types of things at the conference. So we certainly encourage that. We do have a sponsorship package developed where you can sponsor at different levels depending on your financial resources, right from $100 to $1,000. And certainly we would welcome any potential sponsors to reach out, certainly to myself. The website that we've developed for the conference also has a registration as well as that sponsorship link where you can find more information if that is of interest to you.
Excellent.
I would just support Carol as well. One of the categories of the sponsorship is also a conference friend, which is the lower end of donations, but it's also critical that your organization could potentially have a table, be featured on what you do to contribute to that community wellness. So if people are thinking of sponsoring to allow as many people to come to the event, and at the same time, also participating, potentially bringing a table and resources to the discussion and interact with people. The other thing that's really important about the sponsorship is that it also allows people who may not be able to afford to come on a professional level, but are able to come with their voices. So I work with a poverty task force. It enables our community voices, people with lived experience, to also participate and bring their voices to the table for the community drug and alcohol strategy or others where we've got a variety of voices included. So it's really important that some of those sponsorship dollars, although we break even on the cost of the event, also may allow a little bit of subsidy to allow somebody to participate. So those voices are really important as well, because we want to look at how people of all economic levels thrive and do well in our community.
Excellent. So just to clarify, sponsorship packages are available, supporting tables. Obviously, I will want to attend and I'll be purchasing a registration. But if I understand, you can pay for an additional ticket or tickets, right, through the registration?
Yeah, we do have that option, Carol, on our registration page. So when you register for yourself through your organization or individually, there is an option to click on a button to sponsor a registration as well. So you would essentially be paying for two individuals, and then we would find an individual in the community who may not otherwise be able to attend due to financial restraints, and we would offer them a free registration based on that gracious donation of an extra sponsored spot.
And that's how we get the extra voices, or to include all voices, really.
Absolutely.
So there's many ways to support this initiative. Now, before we go too far, Jason, you have a co-chair, right, on this initiative, this project?
Yeah, Sarah Cowley and myself co-chair the Healthy Communities Partnership. Sarah is the executive director at the YMCA Grey Bruce Owen Sound. So we've been kind of leading this charge. But we have a very large planning committee, as you know, Carol. There's probably, I would guess a dozen, maybe 15 different individuals and organizations represented on the planning committee. It's a quite a bit of work to pull one of these events together.
I'm learning, and it's almost it's a process of engagement even as you plan something like this, where people start to network and learn from each other and connect. So the learning happens even before the event, and I think that's quite a remarkable thing, I think, and maybe something you don't think of at the time when you say sure. But it's been, for me, certainly personally, a remarkable experience to be able to learn and to network in that kind of environment. So let's get down to the real detail. And I'm wondering if you would mind going through either the keynote speaker topic or most assuredly those breakout sessions and how people can choose, or what's going to be the meat of this in each one of those sessions.
Yeah, for sure. So for Tuesday, we have Dr. Elise Levi lined up as our keynote speaker. For those unfamiliar with Elise, she is a member of the Chippewas of Nawash First Nation, and she is a registered dietitian as well as a family physician, and just doing some wonderful, great work in the Grey Bruce region. And we're super excited to have her speak on the Tuesday morning. Following her keynote, we will move into some breakout sessions. So we have 3 breakout sessions planned for the morning and another 3 planned for the afternoon. So delegates at the conference would pick one of those sessions of interest in the morning and another one to attend in the afternoon. So those will be running concurrently. In the morning, we have one session focused on age-friendly communities. So looking at kind of that 880s concept of youth to seniors, how do we make a community friendly for all ages? The second session in the morning is culturally safe and sensitive practices and care. And then the third session to choose from is focused on work, income, and well-being. So those are the 3 sessions in the morning. And you can, when you go in to register, you can pick which session you're most interested in. And then for the afternoon, we have a session focused on equity and access to palliative care. A second one focused on belonging, inclusion, and newcomer wellness. And the final breakout session is focused on healthy land, healthy water, and healthy people.
Excellent. Jill, from your perspective and your lens, there are certain topics, obviously, that resonate with what you do in the community, and I wonder if you'd like to speak to those.
Sure. So there are just about all of them do connect with the work that we do at the Poverty Task Force and at the Children's Alliance, but certainly in the morning, the culturally safe care practice is something that I'm personally very intrigued. And I've heard Dr. Levy speak before. She's fantastic. So it'd be interesting. But I think for work, I'm going to end up with the work, income, and well-being pathway, because Poverty Task Force spends a lot of time advocating for sufficient income and income solutions to some of the basic need issues that we have. So we know, as part of the social determinants of health, sufficient housing, food, and health care is really, really important. And people just don't have enough money to be able to afford good housing right now. We don't have enough housing for everybody. We have challenges with food insecurity. We know that, some of our community meal programs have gone up 300%. And so we just know that there's a lot to do with that. And so what I'm intrigued about with the work, income, and well-being together, it's not get a job anymore, because a job doesn't pay you enough to meet your basic needs. So it's having that discussion. 4 County Labor Market Planning Board has the data. YMCA Employment Services and Jen Linkletter over at Georgian College are all looking at skills, trades, employment opportunities. But from the Poverty Task Force, we come along and say, okay, how can we support work that is going to pay the bills, that's going to pay the rent? What do we look at in terms of a living wage? And how do we reduce some of the precarious work practices that are happening in our area? All of that being knowing that income is a critical aspect to being well. And we know from a lot of studies, most recently the Health Starts Here report from Public Health talks about the social determinants of health, and income is one of those ones. We need to have sufficient income and benefits to be able to participate in our healthcare system.
Sorry, my dog was barking in the background. I had to make sure I muted. So that's really important for a go forward, because the theme is building a culture of wellness, and that certainly goes across the whole spectrum. Jason, I think you mentioned around the word rural and connections in a rural perspective. I'm wondering if either you or Jill want to talk a little bit more about the challenges, because we live in such a geographically distinct area and a rural area. And the area that really interests me certainly is around palliative care, because I believe we have been innovative around new approaches to palliative care, even for those who are unhoused. And, I think it's really important for the listening and viewing audience to know we're already moving things forward. Come find out and share what you have as well. Who would like to speak to that?
I can speak generally. I don't have a whole base of knowledge on the palliative care front, but I do think there's a lot of good work happening in terms of being an area of rural excellence. We know that there's lots of differences between urban and rural centers, and often the funding, supports, and resources that we have in rural Grey Bruce doesn't match what's being offered to larger urban centers. So we have to be, I would say, creative and unique in our approaches to addressing some of these complex issues. And honestly, I think Grey Bruce is very much seen as a leader in that regard across the province in many areas. And I think this conference will help us build on that reputation.
Yeah.
In speaking to people that are unhoused, that was a huge gap that was identified for palliative care. I know that the project that Safe and Sound has started up with Kate Dickinson will be featured. And part of that is Kate is working with the SOS team and with people that flow through that are unhoused, and actually having equitable services, even to what currently exists, is a big challenge. Locating people, working with people from a mental health perspective, and then also addressing the physical perspective is really challenging if you're unhoused. Tracking somebody, maintaining their health while unhoused, and also possibly geographically moving. We know there's a lot of movement between Saugeen Shores and, say, Owen Sound. So you may get discharged from the hospital, and then who's going to track your health care if you're unhoused, right? So I know that several people, Kate and Lindsay, and Home and Community Support Services, it's one thing to work with people when they're housed and to see where we can offer that home care or that other locations with a lot of the hospices. But what do we do with people that are not housed or not staying in a regular location, so that you can have consistent care, which is really critical around palliative care?
Exactly. Jason, one of the key learnings for me, and certainly I've interviewed speakers and yourself from public health before, but holding these conferences, when you think of public health, you don't always think of an organization that holds conferences. You think of programs and services. But holding conferences to draw people together is a key feature for public health. How did that ever begin, or was it just a desire to reach out? Not to put you on the spot, but
No, that's quite all right. Yeah, programs and services are core to what we offer, but I think part of what public health is about that upstream promotion.
yeah.
And we really feel like community engagement is a key part of that upstream promotion. And this is really what the conference is designed to do, to bring people together, to have these discussions, to network, to engage, and come up with collective solutions that will improve the health and well-being of our communities.
I would also join in and say that, Grey Bruce Public Health is a backbone organization in so much of the work that we do as partners. And so it's one of those critical in the 20 years that I've been here in Grey Bruce. It's been a backbone organization that has stood for not only responding with programs, but it's been so proactive in working with us to look at how to get ahead of the game on some issues, and to do the research behind it. It's evidence-based, and I think that also comes with the people that we're bringing to this conference also come with a lot of, information and evidence that says this model's working because we're doing this. And something that the public health brings to the table is the research, the statistics that says, here are the numbers and these are why something is improving, or here are the numbers, we've got a gap, we need to address that. And that is something where public health has been there for both the research, the programming, and then the advocacy that they do to say we need to improve ourselves. And here's collectively, a conference that allows us to have those discussions and brings us together.
Yes, and that's the profile that I think is so critical for our communities, for health and for wellness, as well as having organizations who are willing to move forward. So thank you. You said it so much more eloquently than I ever would. So how did you pick the topics? I remember at the last Healthy Communities Conference, Georgian College, and there were others present, and they talked about drawing unlikely actors together for solution finding. So I'm wondering, the topics are various, and of course the speakers will be. How did you actually come to land on those particular topics?
It was a lot of discussion and brainstorming and back and forth. I think, Carol, you've been involved since about June. I think we started some of these discussions. So yeah, it's a lot of back and forth. And clearly we can't cover everything. Mm-hmm. We could have included twice as many breakout sessions on key topics. We just didn't have enough time in the day. So we just really wanted to focus on the positive, the innovative, the upstream approaches, which I think we've set a really good lineup to accomplish that. Additionally, the one piece we haven't really spoke about is the end of the day. And I just wanted to point out that Georgian College's Social Innovation Lab is going to kind of lead the action planning portion at the end of the day. So we're going to hear all this great information, hear about these upstream approaches, and then Nicole Norris and her team are going to kind of pull everyone together to lead us and leave us in a spot where we can action plan moving forward. So the conference doesn't really officially end at 4:00 on the Tuesday. We're going to keep pushing some of these issues forward based on the conversations and work that happens during the course of April 28th.
And that's critical. Often you hear a call to action, but you phrased it as an action plan, because then it can continue to move forward. It's just not a 2 days and done kind of episode, for sure. So we have about 4 minutes left in the program. What haven't we touched on? Jill, what would you like?
I think, having a conference this year in a municipal election year is really, really critical. And so we haven't touched on that, and Jason may not like my politics, but in the sense that it's really critical that we feature and allow community to be engaged in this dialogue, because it is something where we do want municipal leaders to be engaged as well, people potentially running for municipal council. It's something to take forward this year and to think about in terms of election issues. It's not telling you one way or who to vote for or any of that information, but it is getting to know our community better and perhaps other people's communities better. But certainly we want throughout this year to have more people be more aware of the issues in their respective community, and then be able to use that information for dialogue with potential candidates in the municipal elections in October.
And I think certainly that's valid. I'll take off my politician's hat. Closure. because of COVID, there was a bit of a delay, right, around initiating it. So the timing of an election year happened to be coincidental, I'm thinking, but
You
maybe.
didn't plan it. I'm just putting it in there. Sorry, Jason.
But advantageous because
Yes.
we need all policymakers, we need all decision makers in every different aspect. We talked about connections through communities. And so organizations and those who have the ability to make those key decisions or the lever the things forward are critical. Upstream, we talk a lot about solving issues on the ground, the grassroots initiatives, which our communities absolutely depend on. Upstream, briefly, what do you mean by upstream?
I think for me, I would define upstream as looking at the kind of the core cause of an issue. So not treating someone when they're in an emergency or in a crisis or in an ER, but looking upstream. How do we shift that needle so that people have the supports they need, they have the income they need, they have the education they need, they have the resources and supports around them, so they don't move down that needle towards that crisis where we need to intervene on an more urgent basis. So trying to move that needle to give people the supports they need to avoid those emergency crisis type situations.
How about you, Jill? What do you think of as upstream?
Well, for me, the upstream is as Jason said, we want to catch people before they're drowning in crisis, and then we do that quick crisis response, and then we throw them back in the river sometimes. So, people are constantly being thrown back in the river. So we pull them out for a little bit of time and then they get thrown back in. So upstream also looks at what are the more permanent structures we're putting in place to respond to people. So it's not just a pilot. It's not just a feasibility study. It becomes part of our core programming, becomes part of the structure that's in place, so that we're not constantly throwing people back in the river. And I feel like in my role and my job, I'm just seeing people in the river and we're pulling them out one by one instead of actually getting the big ship upstream,
Excellent.
fixed, ready, plug the holes, make it sturdy, and ensure longer term funding for it. We certainly know in the healthcare system, there are gaps in shortages that we are experiencing now with long wait times for services, ERs closing. So there's a variety of things that we need to get right. And we need to fully fund them so that the ship will go down the river with people, so that when people do have health experiences,
Excellent.
wellness experiences, the ship is there and they're on the ship instead of drowning in the river.
So we're inviting everyone to join us on the ship. And I want to thank you both for being on the program. The time has just flown by, and I want to encourage anyone who's listening or viewing this program today to go online, look at the website, register and attend the course April 27th and April 28th for the workshop or the conference, I should officially call it. Please join us to build a culture of wellness. Thank you so much, Jill and Jason. This has been excellent. And thank you to our viewing audience. Please join us again. Take care.
Connect with us by visiting our website or email us at comments@rogerstv.com.
I a champ.
I am a member of the Warham's Child Amputee Program. Through CHAMP, I get the artificial limbs I need to